Good afternoon and welcome to University Hospital's conversation about a return to dance and activity. I'm Macy Jepson, Senior Communications Specialist at University Hospitals, and I am glad to serve as your moderator today. Boy, it has been a long 3 months. Dancers, gymnasts, athletes of all ages are so anxious to return to the studio or the sport that they love. COVID-19 has stopped us in our tracks, and there is a lot to consider as we get moving again while avoiding injury. We will hear from our panelists today and then open up the webinar to you, our viewers, for live questions, which you can submit at the Q&A section of your Zoom screen.
I'm Amanda Weiss-Kelly. I'm the Division Chief for Pediatric Sports Medicine at Rainbow Babies and Children's Hospital.
I'm Anna Cerveny. I am a physical therapist at main campus. I work with outpatient physical therapy, but I also work with dancers, and I work with the Cleveland Ballet every week, which is awesome.
And I'm Gladys Guadalupe, Artistic Director of the Cleveland Ballet. And yes, we have Anna here almost every Thursday, which is great.
And
okay, so I can see one question that's come up. And the question is, what's the best way to alleviate or treat a Charlie horse, especially when they occur at night while sleeping? So if you're actually having a Charlie horse, in the middle of the night, frequently it occurs in the calf. And while it may seem counterintuitive because it hurts a lot to stretch your calf, if you pull your foot, your toes kind of up towards your head and stretch your calf out, that will usually stop the cramping from happening. But obviously what you want to do is try to prevent them from happening again. And there are a variety of tricks that you can try. They're not all caused by the same thing. So sometimes there can be electrolyte problems. So if you're not getting enough salt or enough calcium in your diet or enough magnesium, sometimes that can trigger cramps. Sometimes fatigue can trigger cramps. So if you're doing a lot more of an activity that is unusual for you, that you may trigger cramping in the evening. Making sure that you're well hydrated is important as well. So with lots of athletes, when they get cramping during activities, it's a result of inadequate hydration or salt intake. And so we are one of the few doctors in the world who are always telling people to get more salt in their diets. Is there anything you can think of from a physical therapy perspective, Anna?
I think you basically covered it. As far as Charlie horses go at night, I think that sometimes it can help to take a multivitamin or, make sure that you're getting enough electrolytes after you exercise, stuff like that. So looking at diet, if it's something that's happening all the time, and your vitamin balance can be helpful, as well as drinking enough water. I know a lot of people stop drinking at night because they don't want to have to get up to pee, but that can create more of a Charlie horse at night. Macy, are you back?
I am, and I don't exactly know.
Would be a great one for Gladisa and Anna to tackle together. And that's, what evaluation tool do you use to determine if a dancer is ready to go on point?
I can go ahead. Anna, I can go?
Yeah, take this.
All right, so it is a matter from our artistic perspective. It's a matter of strength. The kneecaps, the calf, the ankle, and the hips. Placement is very important. The legs have to be fully stretched from the back and pulled up from the front. The ankle has to be strong. If you put a child on point way too early when they don't have a placement of the hips, the knees, and the ankles, you are open to injuries and perhaps chronic injuries that will never be able to surpass that. So we take that's a very delicate question. You need to look at the placement of the hips, the placement of the knees, the strength of the ankle, and the strength of the leg altogether.
Yeah, I think there is some research being done in the dance world now to look at different tools that we can use to determine if a dancer is safely ready to go on point. The most basic of those is called the pencil test, where you're looking at, if my hand is my foot, you're looking at to make sure that this line between the ankle is totally straight, because if not, they're never going to be able to get up on their point shoes.
That's correct.
But there's also tests looking at stability of the ankle and strength of the ankle, as far as, do they have that power to be able to produce to get all the way up on point. But I think at the very basic level is, do you have the range of motion to get all the way up? Because if you don't, you're now not safely on your point shoe.
Correct. Yes.
Ladies, the challenges of technology.
Right.
Thank you Dr. Weiss-Kelly for jumping in as moderator. I am back for the moment, and we are starting to get questions. So why don't we hear from our guests right now? And this was to be expected. Please address the issue to wear or not to wear a mask in class. Dr. Weiss-Kelly, could you touch on that?
Sure. So the current feeling is that if you are indoors, it is always preferable to have a mask on. There is no danger to wearing a mask, particularly the cloth masks and the surgical masks that most people have access to. And you're not going to rebreathe carbon dioxide. This is not going to cause any problems. It is uncomfortable. People don't like it. They may feel more short of breath because they don't like how it feels, but it doesn't actually cause problems. If you are at a dance studio or participating in a sport where you are outside and able to maintain a 6-foot distance, so that's important, both outside and 6-foot distance, it is reasonable to participate without a mask on. And when people are exercising very hard, like when you're sprinting or running, it often feels even more uncomfortable to wear a mask because as you breathe deeply, the mask kind of sucks into your mouth. And so it can be very uncomfortable. And in some people can even induce anxiety. But certainly all of the bar work that happens at dance class can and should be done with masks on, particularly if you're inside.
Thank you. And Gladisa, while we're on this subject, we are curious to know about this new norm that includes social distancing and sanitizing. So could you give us an idea of how the Cleveland Ballet has adapted during COVID-19?
Absolutely. You know, we have them coming into the studio at staggered times. They have to take their shoes off. They clean their hands, sanitize their hands. We take their temperature. We go into the studio. We have 6-foot squares already in place in all the studios and at the bar. And once they get into the bar, they wear the mask. They do bar work with masks. And then right after they're done with the bar work, they clean up the bars again. And then we do center also specific 6 feet apart. Like Dr. Weiss-Kelly said, you know, it is a matter of how do you control your breathing. If you start breathing very hard, that is with or without a mask. As a dancer, you need to control that breathing. You cannot go like that because you will lose control, you know. So there is a positive of wearing a mask. It helps you regulate that breathing, believe it or not. You know, we have done it before. We have performed already presentation of 15 minutes where the dancers use that. And it's good because they can regulate not only the breathing, but they can regulate their movement, and they can actually enjoy more to a certain degree, you know. So that's what we have done so far. Anna?
I don't really have anything to add on the subject. I think you guys covered it great.
All right.
There is some concern. A lot of dancers and athletes have been off for, let's say, an average of 3 months. Is that a long time when we think about getting right back into things as if no time has passed, or should they ease into it very carefully?
So Anna and I can both comment on this. This is an issue for all athletes, not just for dancers. Without question, we need a gradual reintroduction to activity. One of the great parts of dance is you do have bar work, and most of the dancers that I work with have been doing bar work at home. And so a lot of them still have managed to maintain their core strength and the range of motion of their joints and muscles. And so those dancers who have been able to do virtual sessions of bar work at home can very gradually start to get back into the floor work. So what worries us the most about working on the floor is, of course, leaps. So, you know, getting back into doing multiple repetitions of leaps several days per week increases your risk for stress fracture.
That's right.
Now, of course, we want people leaping because it's excellent for your bones as long as you give people time to recover. So you're probably not going to be able to do the same amount as you did when you left off 3 months ago. Generally, we recommend that, you know, as a starting number, start between 10 and 20% of where you were before, depending on how much you've been able to do during your off time. So some dancers have a complete studio in their basement and have been doing leaps in their basement. They might be able to start at 50 to 75%. So some of it depends on how much you've been able to do. And also we would recommend really close supervision with the instructors to make sure that the technique hasn't fallen away without someone to watch them every day and say, no, this doesn't look right, no, this doesn't look right, so that you're not getting an increased risk for injury because you've lost some technique without the reinforcement of having an instructor there in person.
Mhm. And
Yeah,
Anna,
I think hopefully, you know, especially with our professionals, and I know Gladys has been giving class to the Cleveland Ballet throughout this whole thing via Zoom. And I assume most of our professional dancers have been, you know, doing something along those lines themselves. So the reintroduction back to the studio shouldn't be too bad for them. It's more the young dancers that we worry about here that are not as self-disciplined, that maybe have taken this time to focus on trying to, you know, do their school studies via Zoom or other things that are not dance. And that's when you run into those issues, is when you've been somewhat sedentary for 3 months and then all of a sudden you come back to your normal schedule. So ideally they're easing back into it. Hopefully we had some kind of strengthening cross training happening at home when they weren't dancing, right? And that's my thing all the time for dancers, is that you shouldn't just be dancing. That shouldn't be your only form of training, that you should be cross training always to make sure that you're preventing injury, because, you know, overuse injuries are the #1 things we see in dancers, and it's just because they're doing the same thing all the time with the same movement pattern. So always trying to cross train and easing back into it as we get back into the studios.
But that is true. The younger dancers, they just want to just jump in and do everything. And when we started open the school, we took it one step at a time. You start doing releves. You could start building from the bottom up, you know, releves at the bar, little jumps at the bar, and eventually introduce those very simple short combinations of jumps in the center. I am one that we have not done big jumps yet. We have not done gran allegros yet. I see it, I feel it. We're not ready. And I'm trying to prevent something that could possibly happen. You know, we have time, but it is true what Anna and Dr. Weiss Kelly say. You have to slowly, not jump into it, but intelligently restart thinking again how to use those muscles, how to build the strength, how to build the stamina, because it is anaerobic, you know. So, well, eventually it will take time. It will take time.
Veronica is a dance instructor. She's looking for techniques to teach her dancers, specifically an approach for training dancers to avoid pain and maximize technique with a dancer who has a hip impingement.
So I guess I can take this one because it's right up my alley. So normally when I see dancers with hip impingement, it is a lot of strengthening. Generally the impingement is coming from an imbalance. So typically that's happening because your glutes are a little bit weaker, your abductors, your adductors, your extensors, right? And then your hip flexors and quads are overworking and tight. So definitely I find that the strengthening aspect of the glutes is really the best thing for hip impingement, but generally I'll do it along with the program of stretching your quads, stretching your psoas, and then some deep tissue work, which you can kind of do on your own with a foam roller, of just like working around all of those muscles that are being overused and the muscles that are being underused to kind of achieve that proper length, because muscles, there's a length tension relationship, right? If a muscle's too tight or if it's too lengthened, it's going to be weaker. There's a happy medium where we want our muscles to kind of sit as far as length goes, so that they're working properly, so that when we are developing our legs, we are not, you know, overusing our hip flexors and quads, but we're using our turnout muscles and using our glutes to avoid that impingement happening. I know there's a certain degree of hip impingement sometimes that comes just structurally from the way that we exist, but there, some of that, you know, we can control what we can control, and what we can't, we deal with.
As expected, there are a couple more questions related to COVID, so I'm going to bundle them a little bit. How do you recommend safely resuming partnering? And then what is the recommended number of students per class as we start back to studios? I would imagine that is determined by the size of the studio. Lisa, would you like to start?
Yes, it is determined by the size of the studio, how many people, how many you can put in the bar, and how many people, dancers, you can put in the center. In terms of partnering, we have started doing that. We did have a presentation and we all wear masks. Same procedures. Every time you touch a woman or a woman touch a man, we disinfect our hands, wash our hands. We do our are partnering, and quickly we go separate ways and continue cleaning our hands. It's a new norm. It is difficult because they get sweaty, the hands get sweaty, and then they get dry. So it is, we have done it, and slowly you have to incorporate all the pieces part. If it's an adagio, if it's a gran allegro, whatever you decide to do with waltz, but it's the same concept. You have to continue cleaning yourself, cleaning the hands, and making sure that your partners change. We change clothing. You have to change clothing as well. You cannot just be with the same leotards or tights all day long. They do class, they change leotards. They do first rehearsal, they change leotards and tights. So it is a new norm. It is.
In addition to that, for the younger kids where you have a little bit more leeway because there's not major professional performances coming up. If you need to partner, try to have the kids partner with the same partner every time. Keep the kids in the same group. If there are kids that carpool together, try to have those kids be partners together, so the number of exposures are as limited as humanly possible, so that if one child gets sick, perhaps they've only been exposed to 2 or 3 other kids at class rather than 10. So don't constantly switch partners if you can help that. Mm-hmm. And the most important thing we can do is, if you are even remotely concerned about any symptoms you might have personally, stay home. Mm-hmm. And Gladisa is correct that if you're going to be partnering, if you're going to be closer than 6 feet together, you have to have a mask on.
Yeah. You have to. There's no other way around it, And I was concerned because of the way they get excited, and like the Dr. Weiss Kelly said, anxiety. But once you start learning how to breathe within that new norm, it's okay. We did have some issues with our legs. That oxygen apparently didn't go to the legs, but we were getting too excited. So we slowly started to learn how to breathe again. I guess that's, learn how to breathe with something in your mouth. Yes.
Gladisa, are you cleaning floors in between classes? Our other panelists, is that a recommendation? How often should that happen?
You should be. We are doing that, and I think everybody should do that. When the company takes class, then we have a little break between the company and the school, and then we do have to clean the bars and the floors and the bathrooms Yes, the bathrooms. We do not allow anybody in the dressing rooms. They come here already dressed with their shoes in their hands, no bags, and they have to bring their own bottled water. And we do the same procedure. Nobody in dressing rooms, nobody hanging out, nobody sitting on the floor. Come in, do your work, and you have to leave. Yes.
Kelly Lightfoot has a question. Is there an age where you would recommend going on point from a skeletal maturity standpoint? She's actually heard of some people recommending an X-ray to see how close the growth plates are to closing. She would like your input on that.
So we don't, as physicians, recommend that. And we addressed this a little bit earlier, that this is much more about your strength, your control, and the range of motion of your joints than it is about your growth plates. There are kids who those growth plates in the feet may not close until they're 15 or 16. And plenty of them develop the strength and technique to be able to go on point before that. So it's really not a growth plate issue. It's much more a strength, control, and joint range of motion issue.
So we have a bowling fan on the webinar whose 17-year-old grandson is an accomplished bowler using the one-hand technique. He's starting to experience some pain when he does his practices. Is there any suggestion to alleviate that knee pain? It's in his knee specifically.
I would probably say looking at form, especially if he's having it as he bowls. I mean, it's the same thing with a dancer who comes in and they're having pain during a specific movement or during dance. You know, if you're having pain during one certain movement, then you need to look at that movement, and maybe the way that you're doing it isn't aligning properly, right? So with our lower extremities, we want to look at our hips, our knees, our ankles being all in one nice straight line, especially as we squat and lunge, which I'm not super familiar with bowling, but I know there is a little bit of a lunge technique to it, right? So making sure that that knee is over like your second and third toe as you are lunging. Same thing with dancers when you're plieing, right? You always want to be turning out enough that your toe or your knees are over your second and third toes. And that's something we see in weaker or younger dancers that haven't trained their technique well, is that their knees tend to kind of fall forward towards their big toes or even further. And that leads to problems like ACL tears down the line that we don't want to deal with.
We're talking a lot about getting back into the game without prevention. And Gladisa, you've seen firsthand the importance of prevention and the difference that makes on the health of your dancers, with University Hospitals being the medical provider for the Cleveland Ballet. Could you touch on that just a little bit about what you do before an injury is so very important?
Well, you know, with having University Hospitals physical therapists here every week, and also the doctors available, you know, right away, they have taught us, our dancers, how to make that movement proper. I can only see it from my artistic point of view, but at the same time, Anna and the doctors have a way of telling us in a different way, this is how you should do this movement. This is the muscle that you should be feeling. This is the way you should do it. I can only do it one way. What happens in the studio, I see something, I don't understand it, I correct it, I go to Anna, this is happening. How do we fix this? Teach us how to fix this. So it is actually, it's great, it's twofold. I can only do the right technique, because there's always a right and a wrong, right? I can only do the right technique, teaching it, educating, and training from young. But Anna and the doctors can give us another way, scientifically, that really makes sense. We don't see our bodies inside, we feel our bodies inside. So consulting with them on a weekly basis and having them here, hands on the bodies, we learn, we see, they move, and it's has made our dancers a lot stronger. And I have given our dancers vast education, not only about the way they're supposed to be feeling, but about the way they need to execute that movement, whatever it is. It is, without them, I have to tell you, we will not be where we are today. They have taught us a lot of the things that we were lacking in the aspect of science. And we have gotten to a point that dancers are very strong, very solid, but science has made this art form a lot stronger, a lot aggressive in the aspect of more turns, more balance, more flexibility in the right way. So having them here, it's for us, every Monday we ask, they're coming, you know, so.
Not everybody, sadly, but not every studio has the benefit of something like this. And I think that the common question would be, at what point during pain do you need to seek help, questions, treatment, doctors?
So
and excuse me.
We recommend, so one, if you've had the pain longer than 10 days to 2 weeks, it's time to get seen. We are not, one of the big fears athletes have is that if they come to see us with pain, we're going to say, well, you can't do that. And physicians and physical therapists who aren't trained in sports medicine may say that. But if you see a sports medicine doctor or a physical therapist trained in sports medicine, we do everything we can to keep you in your sport while we're making you feel better. So that's the number one important thing. Please don't wait 7 months, because then it just takes longer to get better. So addressing any pain early is very important to help prevent pain as you're getting back into activity. It's just so very important to gradually reintroduce anything that you're doing. So, and starting with the easiest form of what you're doing and working up to harder forms, you know, so if you are a hurdler and you haven't been hurdling for 4 months now, you would jog. And if jogging goes fine, then you can start sprinting. And if sprinting goes fine, you can introduce the small hurdles and then the big hurdles. So the same thing for dance. You work on easier techniques first and build up to the stronger techniques, the harder techniques, over a 6 to 8 week time period to help prevent overuse injuries as you're getting back into activity.
Anna, we do have a question about cross training and supplemental training recommendations. Sure. For college and pre-professional dancers who are not being allowed to return to studios right now, and they must continue their primary dance training via Zoom. What recommendations do you have?
So real quick on the injury thing, I think a lot of dancers, while we would love for them to come in early, they don't. So definitely when you start compensating, when you have a knee injury and it's forcing you to put more weight on the other leg, or you're now modifying the way you do things, that's when you really absolutely need to be coming to see a doctor, a therapist, someone. So that's my 2 cents. But as far as cross training goes and injury prevention, if you can't get back into the studio, I think being careful with your floor is one of the big things, right? Normally, like as a therapist, I'll send people home like, okay, you're going to do 3 sets of 10 jump squats every day on your floor at home. That's the minimal amount of jumping, I think, is okay on your home surfaces, your carpet or whatever. But when it comes to dance, in a regular dance class, dancers are jumping over 200 times. We've done studies that have shown this. So it's a lot more jumping. So that would be the number one thing, is just being careful about jumps if you're still doing Zoom from home. As far as cross training goes, I think keeping cardiovascular endurance up is huge. It's one thing that dancers tend to lack in general, and it leads to a lot of injury. So, when you say cardiovascular, a lot of dancers think, oh, I hate running, I don't want to run. Running is not the only way to get cardio in. You can swim, you can bike, you can walk at a fast pace. There's a lot of other ways to do cardio. You can do some high intensity interval training too, where you're just doing more strength training activities at intervals to work on your cardiovascular system as well. So cardio is a big thing. And then adding in some kind of body weight strength training, something to supplement what you're doing at dance, will actually make you a stronger dancer. I know a lot of dancers are wiped out after class, or they feel like they don't want to get bulky and they're scared of strength training because of that. But in all honesty, really, your strength training is going to improve the way you dance. And I think that's what Gladisa was saying with us being there is, the dancers come in hurting a little bit here or there, and being able to catch it early helps them. And then looking at like, okay, well, maybe you need to be doing this exercise to even out your muscles so that this muscle group is working a little bit more when you're training and when you're doing these things, because the strength is really what's going to keep you from injuring yourself in the long run.
Another question, we've got a couple of minutes left. Another question about COVID and it dominantly being an airborne situation. What are recommendations for addressing airflow issues within a studio? And is that something that even should be considered?
So one of our big issues with this is fans. You may not have fans running, particularly oscillating fans. The only way you can have a fan in a studio is if it's in a window facing out to push air out. So you shouldn't have fans running, and wear your mask, because no matter what the airflow is, your mask and everyone else in the room wearing a mask is going to help prevent more particles from being in the air. And as far as air conditioning systems go, obviously we don't have a lot of control over those. Those are hundreds of thousands of dollars to change air conditioning systems to affect the airflow in that way. So I don't think we have a lot of control over that. But I do think that not having oscillating fans, and if you do have a fan, it should be in the window facing the outside, and that's it.
I've also heard some people say like propping doors open can help with airflow, so you're not just stuck in a closed studio. Even opening the doors to each individual studio, if you can't open the outside doors, but just allowing for more airflow within the space so that it's not just the same air recirculating.
Floating around, yeah, being recycled. Yeah, opening the doors to all the studios and the offices, yeah, it really helps.
I tell you, these 30 minutes have gone by so fast. We're at the end of our time already. Thank you to our panelists for joining us. Thank you all on this webinar for being with us. Anyone registered, by the way, will receive a recorded version of this that you can share with other people. If you would like to make an appointment with one of our sports medicine specialists, you can do that online. We wish you a safe return to the sport that you love. Be safe, be careful, and thank you for joining us.
Thanks for having us.
Thank you for having us. Bye-bye.